Hi, my name is Jesse Simon. I'm Senior Regional Clinical Director for JAG PT, and I'm here to discuss pain with squatting or how to avoid pain when doing squats. So first of all, squatting is a very functional activity. A lot of people get pain when squatting, whether they're trying to prevent knee pain or they're trying to build strength with trying to improve their function in either climbing stairs or walking or their everyday activities or even sports-specific activities. So consider your alignment when you're squatting. So your knees and hips should be aligned properly. You don't want them too far in or too far out. You don't want the toes pointed in too much or the toes pointed out too much. Usually at a general toe out angle, but it should be comfortable. So let's say if you have an injury, you want to have these toes a little bit pointed out. When you're squatting down, you want to have the chest up and the head up. First motion should be unlocking the hips. So a lot of patients that I see, their first motion is knees forward. So we want to avoid that. So you want to come into the hips coming out and then dropping down. So head up, chest up, knees, feet, and hips aligned, and then dropping down like this. So as the hips go back, what a lot of people think is that you want to keep your back straight. But if you're keeping your back straight, you're going to fall backwards. You got to bring the chest forward. If the butt goes back, chest has to go forward to counterbalance the weight. So a proper squat would be in this kind of angle like that. Hips back, you can bring the arms up to keep the chest forward and the weight forward. With the knees, sometimes you have a valgus at the knees, a way of avoiding the knees coming in too much, which can increase the strain on the patellofemoral joint. When people are squatting, a lot of times I see this, and it puts a lot of strain and pain on the lateral patellofemoral joint. So if you put a band around the knees, what that's going to do is engage your hip extensors and lateral rotators to keep the femur more aligned and reduce strain on the patellofemoral joint. So demonstrating squat like this, and you should be able to see your toes. If you can't see your toes, your knees are coming too far forward. Another way of maintaining good alignment is putting the wedge under your heel. So if you have tight calves or tight hip flexors, sometimes that alignment is difficult to attain, and it's going to force them to come too far forward, which is going to put strain on the lower back. So if you put a wedge underneath the heel, that will make that. Having some tight hip flexors, one good stretch that you can do is a hip flexor stretch. If you have a strap, a towel, or a band, dropping your leg off the side of the table, other knee bent, make sure the hip is going into extension and gently pulling back. Stretch should be felt from the hip into the quad, usually holding 30 to 45 seconds, 3 to 5 times. Calf stretch, back leg flat, knee straight, bringing the hips forward, which will get a stretch into the soleus and calf, so you can gain more dorsiflexion in the ankle. I hope these tips in this video helped you. If you'd like to see more exercises, please subscribe to this channel, and you can book an appointment at jagpt.com.